Good afternoon, everybody. My name is Teddy Owusu. I'm the Preconception Peer Educator Program Coordinator. We are joined today by Dr. Nakeitra Burse. She will present on utilizing philanthropic efforts to create career opportunities. Before we start, please note that all lines are on mute. We will be taking questions following Dr. Burse's presentation. You can ask your questions using the questions window in your control panel. You can expand it out or remove it from the control panel to ask as many questions as you like. Dr. Burse will address any questions regarding the presentation after she finishes. If you have any audio issues or other issues, you can contact staff through the questions box as well. Now, our speaker, Dr. Nakeitra Burse, is the owner and CEO of 6 Dimensions LLC, a public health consulting company dedicated to creating healthier communities through innovative, strategic, and sustainable public health solutions. In her previous work, Dr. Burse has worked across various sectors such as nonprofit, government agencies, and academic institutions. She served as the director of community-based programs for My Brother's Keeper, Inc. Through her current public health consulting services, she has had the opportunity to work in several capacities within the state of Mississippi as well. Dr. Burse holds a degree in biological sciences and a master's in health education, health promotion from Mississippi State University, and she received her doctorate in public health from Jackson State University. Dr. Burse has always been dedicated to the health, wellness, and strengthening of underserved communities, and she considers herself to be a servant and a philanthropist who is understanding and empathetic of the issues facing minority communities. She has served in the field of public health for over 8 years, and she is also currently an adjunct professor for the Jackson State University Department of Health. So we have a great guest with us, and without further ado, Dr. Burse, whenever you're ready.
Good afternoon. I hope all is well with everyone. I thank the Office of Minority Health and Mr. Owusu for inviting me to speak with you all this afternoon. We talked about, well, our plan today is to talk about turning passion into profit. And I just wanted to talk to you all a little bit about how I got to where I am today. It has been somewhat of a long journey, but also a fun and learning journey. So I've always wanted to be in public health. I've always wanted to do something in the field of health, but I wanted to kind of be able to do it on my own terms. And so everything that I've done up to this point has gotten me to this point where I can kind of make some decisions on my own and really, really change the health of our community, just one community at a time. So today, our learning objectives are, by the end of the presentation, I want you to be able to understand the role of entrepreneurship in public health, also understand the advantage and disadvantages of entrepreneurship in public health, and take some time to examine your interests and strengths relative to your career choices. And I say that because as we get into the presentation, I'll talk a little bit about my background and some of my interests and how they didn't always align. The career path that I was choosing didn't always align with my interests. And so I hope that by the end of this presentation, you'll be able to just take some time and really think about where you are in your collegiate career and where you want to be in your career after you finish college. So this poem, most of you have probably already seen it several times over and over. And I won't read it to you, but I'll just say that I use this kind of when I'm getting ready to embark on a different journey and I may not be so confident in myself, but it helps me to remember that I'm on this journey for a reason, and the reason is to help other people. And so I don't have time to retreat and dim my light. I have to just step out and do what I'm supposed to do and be confident and bold and understand that everything I'm doing is for a reason. So I just kind of use this when I'm kind of getting in a position where I want to kind of retreat and not move out of my comfort zone. And so I hope that maybe you can do this also. So today I'm just going to kind of use some illustrations, and I have this first thing as the destination, and that's where I want it to be. I incorporated my business in about 2011. I wasn't doing anything with the business, but I incorporated it in 2011 because I knew where I wanted to go. So it was nothing but me going to on the website for the Secretary of State, filling out an application and paying $50 to get my business incorporated. So that kind of made this whole thing real for me, made me have something to be working toward. And so the vision for my company is a world where communities are holistically healthy. I want to, in a perfect world, the pie in the sky, I want all communities to be healthy. Now, is that realistic? Maybe not. But if I know that I'm working toward that every single day, that makes me get up and keep going. And so my company's mission is to create holistically healthy communities through innovative, strategic, and sustainable public health solutions. And I created this mission for the company because, number one, as you see, the company is called 6 Dimensions. As I was going through my graduate programs, I started thinking about, I would go on these interviews and do internships, and I would always think about health as not just one-dimensional. There are so many things that come into being healthy and obtaining just a balance in well-being. And so I thought about holistic health. And so every community that I enter may not have the same interests at the forefront of their mind. And so it's my job to make sure that I'm tapping into all of their interests and what's important to the community as opposed to what I think they may need. And then I talked about innovative, strategic, and sustainable public health solutions. As we move through public health and look at different organizations and different funding, organizations right now are struggling to keep their doors open because of different cuts in funding and different things. And so I want to create organizations and programs that are sustainable. So after the funding is gone, these organizations can still help serve their communities. And so that's how I kind of came up with my mission. I talk about it passionately because this is really what gets me up and going and working every single day, even on a late Saturday night when I'd rather be doing something else. This is what keeps me going. So what I do, develop innovative, strategic, and sustainable public health strategies to improve the health of communities. And so I talked a little bit about 6 dimensions, and there are essentially 6 dimensions of health: spiritual, physical, mental or emotional, vocational, and environmental. And so each community, every person, no one has that same core value of health. And so it's my job as a public health professional to understand what's the most important value and how we can revolve all of these other things around it. For example, I live in Mississippi, I'm from Mississippi, and so we're in the Bible Belt. And so going into communities, the number one thing that I have to understand is that these communities are really downright to the core Christian communities. And so for me to just come in and start talking about or trying to get them to make all of these changes without acknowledging what really helps them move forward, then I'm doing a disservice to them. And so my company is basically focused on trying to see what's important to the community and creating things around all of that. Okay. So my 6 core principles, and here's my logo, are innovation, integrity, accountability, cultural awareness, equity, and community involvement. And all of these things really help me to make a difference in all of the communities that I work with. I try to develop innovative strategies to help them move forward, because sometimes we see a lot of the same things or same types of programs over and over because they've worked in communities. But if we really want to move our communities forward, we have to be innovative and develop strategies that are new and fresh and really get people excited. And then integrity. I try to do everything and lead my company with integrity and accountability as well. And then cultural awareness. One thing that I've learned throughout my career is that if you can't connect with different communities, then they're going to shut you out from the beginning. One example that I'll give, when I really kind of started this work, I went on a trip to New Jersey to do a presentation for an organization, and I was new to the area, but the co-facilitator that I was working with, he had some knowledge of the community, and so when we went in, he was talking about some things and political things that were going on within the community, and so one participant really got defensive and said, "You don't know us, so you can't come in here telling us what to do or how to do it. You don't know anything about our community." And so at that point, even if I was presenting cultural competency, it was important for me to be culturally aware of the community that I was going into, because if you don't establish that rapport in the beginning, then they'll completely shut you off. And then equity. Health equity, health disparities, we see a lot of this in our communities, and that's one thing that I really want to work on is making health and health care equitable and accessible for all communities. And community involvement, I've always been the type of person that is really immersed in my community, and so one of my principles for my company is I want to stay true to that, stay involved within the community, and never have that disconnect with the community. So the intersection, merging my passion with profit. So there are kind of 4 quadrants that I grouped this into to really pull myself into this entrepreneurship role. So my personality, everyone probably calls me an extrovert, and I'm pretty sure by all of the personality tests I am categorized as an extrovert, and so I really like being around people. I like learning about people. I like learning new cultures. I like visiting different communities, different countries, just to learn about the culture. And I've also always had an entrepreneurial spirit. So I've been a personal trainer and fitness instructor. I started my own boot camp when I first moved to this area, and for probably 3 or 4 years, I grew from just doing a boot camp for free with a few of my friends to really generating some income with over probably at the most 40 to 50 participants. I've pretty much done all kinds of entrepreneurial things. My sister and I started a scholarship for our community. I've always just liked the risk and the rush of being an entrepreneur. And then observation. In all of my job experiences, just life experiences, I've kind of just been like taking mental notes about some of the best practices that I've seen within organizations, that I've seen within businesses, and then I've also taken note of some of the detrimental practices that I've seen so I can know what's right and wrong about that. And then passion. I really have always just had a passion and a love for health, fitness, and wellness, and just a desire for a better community all the way around, not just in health, but just a desire for a better community. And then I've always been kind of a visionary. I kind of set a standard for how I wanted to live, what type of salary I wanted to have, what types of things I wanted to be able to do, and then I wanted to kind of obtain a job with all of it that just had everything that I wanted. And give or take, you probably won't find that, and so that's kind of how I got into the whole entrepreneurship and public health. So my life's journey. So I always had an interest in healthcare and the field of health. When I was in high school, undergraduate studies, I was going to be a pediatrician or an OBGYN. I was going into the field of healthcare in some way. But I came from a small community. I have an aunt that's a physician, my mom is a nurse, and so I really did not know about other careers outside of like the big careers that you hear about, like a doctor, lawyer, teacher, all of these blanket careers that we hear about. I didn't know that there were things that you could do to still make an impact and make money within those careers. And so I went to undergrad at Mississippi State University, and I majored in biological sciences, pre-med, and by around my junior year, I was like, I do not want to do this. Chemistry, organic chemistry was literally killing me. Physics was killing me. Just a moment of transparency, I took organic chemistry 1 and 2 twice. I took physics 1 and 2 twice also. So I was just trying to figure out how do I, number one, tell my parents that I really don't want to do this, and how do I finish this degree and do well in it because I'm so far into the degree. So needless to say, I did go ahead and graduate with a degree in biological sciences, pre-med. So after that degree, I went home, back to my parents' house, no idea what I wanted to do. My dad had a connection and hooked me up with a job at the school district where I was the AmeriCorps director. They had a grant, and I had about 6 months left on the grant, and so they gave me the job to kind of let me coast out until I figured out what I wanted to do. And so the job in AmeriCorps had absolutely nothing to do with what I wanted to do in life, but it really opened my eyes a lot. I worked right in the community, and we were doing reading and math programs for elementary school students. But as I was going through this program, I started seeing these kids that were having health issues, that were missing school, and just being right there in my community and seeing all of the issues that were happening within my community. So I started Googling other careers, literally Googling other careers in health outside of the medical career. And so I ran up on something that I had no idea what it was, and it was health education. And I was like, I have no idea what this is. And so I started really just reading up on it, and then I ended up going back to school for my master's in health education, health promotion. And at that point, I was about 21 or 22 years old, still had no idea what public health was, but I knew that I liked health education. And so as I got into health education and started doing the work, then I really realized what public health was. That degree opened my eyes to public health. And so after I got my master's, did my master's in a year, totally had a 4.0, like did well with that. And so I was like, okay, this is the career that I want to be in. So at that point, I started working with the university, doing a physical activity program all over South Mississippi. And so at that point, that's when I got it. It's public health. That's where I want to be. That's what I want to do. And so I started pursuing a career with everything that I wanted. And so the first one that I went into was a job with the Mississippi Department of Human Services, where I was the abstinence coordinator for the state. And although I loved that job and was very appreciative of the opportunity, it was a job where I had to clock in and out every day, and it offered a little more structure than I really wanted in my career. So I started looking more, and I landed a job in the nonprofit organization that I worked for prior to pursuing entrepreneurship. And it was everything I wanted. I got an opportunity to travel all over the United States teaching about health and communities become healthier. And when I got that job, I started that job in 2010. And from 2010 to 2016, when I left, I matriculated from the lowest person on the totem pole to the highest person under the CEO. So when I left there, I was the director for the Center for Community-Based Programs. There was no more room for advancement with me, and I really used every opportunity that I was awarded in that career, and it really leveraged my career to where I am now. And so then I received my doctorate in public health, and that's when I said, okay, this is it. And I totally believe that in life you are awarded opportunities to make a difference and do what you love. And so I feel like everything from me having an interest, just an interest, and not knowing anything in the field of public health, to going all the way through and getting 2 degrees and completing my doctorate, through everything that was going on in my life at that time, it was where I was supposed to be. And so after I completed my doctorate, I continued to work for the organization for a while, and I still kept having that tugging and that tugging feeling. So about midway through 2015, I had a talk with my family, and I said, it's time. It's time for me to revive this business that I have already spoken into existence. And so I started saving money and getting myself together. And in January of 2016, I got to a point where I could leave that job and pursue entrepreneurship. And so why entrepreneurship in public health? For me, it has been fulfilling a desire and working towards something much larger than myself. Every day I tell myself, you're not doing this for you. You're doing this to make a difference in the world. You're doing this so that young children will have an opportunity to health and healthy living and access to good health care. And then also it doesn't confine me to one sector. I got my degree in behavior, and so a lot of the things I do are program development and behavioral type things in public health, but I also have the opportunity to gain valuable experience in epidemiology and biostatistics and evaluation, because right now I have to do everything. And so this really kind of makes me more versatile, I'll say. I always say that my dad always told me to know a little bit about everything so that you can have a really good conversation with anybody you encounter. And so I kind of translate that over into public health. So if I know just a little bit about every sector, or as many sectors as I can in public health, then I can really, really make a difference in these communities. And then also I get the administrative and hands-on experience. I'm a community person. I love being in the community. I love working with the community. But owning a business also, I have to be able to do all the administrative things, the tax things, the legal things, and making sure contracts are correct and reviewed correctly. So it really has pushed me to be a more versatile person. So with everything, there are always advantages and disadvantages. So I'll start a little bit with the advantages. So number one, a flexible schedule. So I typically work from home. Some days I get to go to different offices and work from different offices, but I typically make my own schedule, and you'll see that come up again in the disadvantages. And then non-traditional hours, so I don't have to go in at 8 o'clock in the morning and get off at 5 o'clock. So if my son has a doctor's appointment at 10 o'clock, I'll develop my schedule and my hours around what I have to do that day. And then there's no salary cap, and that means there's endless earning potential. It's just if I'm willing to do the work to earn that. And then there are no limits to what you can do if you're willing to, and like I spoke about previously, dive into other sectors and really learn skills and different skill sets that apply across the board, then there's endless potential. For example, I know a young lady who's a speech therapist, and she wants to develop a curriculum for young students for speech therapy. And so she came to me to talk to me about developing her program. And so although I don't know anything about speech therapy and dyslexia was one of her issues, although I don't know anything about that, I'm able to translate the skills that I have to help her develop a program that will be able to make a difference in the lives of the children that she works with. And then endless networking opportunities. As I stated before, I'm an extrovert, and so I get an opportunity to speak with different people and just to develop relationships with different people and different organizations. And so it really never gets boring to me. And so then I'm able to do what I love every day. So on to the disadvantages, because I probably made it kind of sound like it's just so awesome, which it is, but there are always disadvantages when you decide to embark on a career on your own. So financing, everything, either you have to get loans or you have to get everything out of your own pocket. And so right now I kind of save on overhead costs by not purchasing an office, but I also have areas that I can go to for office space if I need it. So fortunately for me, I haven't had to get a business loan, but I have had to use the money that I saved to do different things, like to invest in myself, to purchase different, purchase a website and things like that. I've had to come out of my own pocket. And then sometimes contracts are short. They may not last for longer than a year. And so then sometimes you find yourself in the hustle and bustle of trying to get contracts to make sure that you are still bringing in money, especially if you have a family. And then back to those non-traditional work hours. So if my son has a doctor's appointment at 10 o'clock and I've built my schedule around that, that may mean that I have to pick up those hours late in the evening after he goes to sleep at maybe 10 o'clock at night. Or I may have to, I may be working on a deadline, so that means that I'm working all day, Saturday and Sunday. And so a lot of the times you are working around the clock. And then there's not a lot of structure, and so you have to, coming from working in an office and in an organization, then there is that structure. But right now I'm the only person working in my business, and so I have to create a structure for myself. And then also balance. So it's work, work, work all the time, and so I have to find and make myself sometimes say, okay, I'm going to go get a manicure. Okay, I'm going to go watch a movie, or we're going to go have a nice dinner this evening. Because it's the fact that you want to do what you love, but you also have to, realistically speaking, have to feed your family. And then short staffing. So like I talked about before, right now I'm the only person in my business, and I hope to change that very soon. But I have to do all the work, whether it's renewing my business application with the Secretary of State, to developing things that clients may want me to develop. So I have to do all of that, and that is sometimes one job that typically maybe 5 or 10 people would be doing. So those are some of the disadvantages. So what does it take? The picture that I have here, I really like it because all the shoes are the same, and then that one pair of shoes that stands out, they're different. And that's typically what it takes to embark on a journey of entrepreneurship. You have to be willing to step outside of the box and do things different. You have to have perseverance and discipline. A lot of sacrifices are made to own your own business, and passion. And I talk about passion a lot because that's what keeps me up at night when I have to work at 10 or 11 o'clock, because I know that the end result may not help 100 people, but if it helps 5 people, then I've done my job. And you really have to have these networking skills, and I always say a high risk tolerance. I've always been a risk taker, and so if there's something that I wanted to do, I figure out a way to do it, and I'll deal with it later. And so that's in business. You just have to take risks sometimes, and then you have to have basic business knowledge. I've been fortunate to be able to have a little bit of business knowledge, although I don't have a business background, just from experience and just from the experiences of my dad being a business owner. And so I've just had that business knowledge, but a lot of people just don't have it. And then financial stability. I would never tell anyone to be your own boss if you have not prepared, and if you have not built a stable foundation for yourself. And you have to know how to manage money, and you have to have good credit. There are a lot of things that go into it before you're even able to pursue your passion. And then research and reading. For me, public health is changing every single day. And so you have to read and stay abreast of current events, and make sure that you just have the basic knowledge of what it takes to even secure a client. And then continuous education, mental stamina. Some days it just gets flat out tiring. I have a 2-year-old son, I have a husband, and so being a one-man show right now, and then still having to take care of the things that I have to take care of for my family, that takes a lot of mental stamina. And sometimes when I fall out at night, I literally fall out. And then you have to invest in yourself. You have to do what it takes to get you where you need to be. And sometimes that investment doesn't take a lot of money. Sometimes it does. Sometimes it doesn't take a lot of time, but sometimes it does. So you have to be willing to invest in yourself, because if you are the face of a business, of an organization, of anything, you have to put your best foot forward every time you step into an arena. So then I'll talk a little bit about some of my successes. I left my job in January. So one of the things that happened, I had one opportunity for a contract when I left, which was what I did not expect. But then I also had an opportunity at a work-from-home job. The work-from-home job was paying much more than what I was making at my regular job. It was work from home. It was everything, and I accepted that job. I accepted it. And another moment of transparency, I worked that job for 3 days, because at the end of those 3 days, I said, this is not why I quit my job. I did not quit my job to work another job. And so I left that job, and I picked up the other contract. And so from January until now, I've obtained 3 contracts, all of which are completely different, in different arenas, doing something different. And so it gives me just a lot of variety. And so I count that as a success. And then I've developed so many new relationships. And here in Mississippi, our public health arena is kind of small. And so the network is very small, but I've had to reach out to people that I've known from previous project officers at Centers for Disease Control to just people that I may meet at conferences. And so I've really had an opportunity to develop some really, really good relationships nationwide. And then a simple thank you. Back in maybe May, I received about 3 thank you letters in the mail, and maybe one by email. And that was all it took for me to say, you're on the right path, you're doing the right thing. Because a simple thank you and knowing that your work is really appreciated goes a long way, and it helps you to keep pushing forward in whatever your dreams are. And then measurable results. So I pretty much keep a tab on everything that I do so I can see how well I'm performing and how well or how I may not be performing so well. And so this just kind of helps me to see where I need to improve. And so the results that I've been given are well right now. And so I think that's one of the major things that I would count as a success are the measurable results that I have. And so some of my challenges or shortcomings, time and balance. That's been the hardest thing for me coming from working 8 to 5. Previously I've had a work from home position, but time and balance was really hard, especially with having a family now. And then overworking. And so a lot of times I find myself, I had gotten to the point when I was working an 8 to 5 where no work is going home unless it had to. And so I trended back into the work all the time. And so then I had to just create a balance and just draw the line somewhere. And then doing it all. Every contract that comes your way, you don't have to take it. And so how I kind of combat that is looking back at my mission. Does this get me or help me to achieve the mission of my company? And if it doesn't, as bad as I may want to take it, as bad as I may want that money, I have to take a step back and say no because I'm not able to give it 100%. And then targeted marketing. One thing when I first started, I had a kickoff event. And it was in my hometown, which is a small town in North Mississippi. And so I came out of my pocket with quite a bit of money to create this day of wellness. And I brought people from all over to come and do health screenings and just all kinds of good stuff. And that day, the community did not show up. This is a decent turnout, but it wasn't a good turnout. It wasn't the turnout that I expected. And so then I had to say, okay, as much as I wanted to do this for my community, my home community, that wasn't the right market to target. And so then I had to back up again and reflect on my mission and understand why I'm doing it and who I'm really doing it for. And so those challenges are all challenges that have been fairly easy for me to overcome. Sometimes learning to say no, that's hard for me because I'm a person that is, very giving. I'm very giving. And so if there's some way that I can help, I always want to help. So they haven't been so hard to overcome, but I have to just keep my mission in the forefront of my head and make sure that I'm doing what I'm called to do. So the road less traveled, the vision for my future. I want to continue helping to create healthier communities. And one thing that I really, really want to do is create opportunities for minorities to gain valuable public health experience. And I say that because, as I stated before, when I was going off to college, I didn't know anything about other careers in health. All I knew about was a doctor and a nurse. I didn't know that there were other careers that you could truly, truly make a difference in. And for people like me coming from small communities where I may not have been exposed to different careers, I want to create opportunities for minorities to gain that experience and to learn and really figure out what it is they want to do in public health. And so that will hopefully create this workforce of trained public health professionals who can compete with their counterparts on a national level to be able to make all the major decisions for our communities that we need to make. So some advice to my younger self and to you. Number one, evaluate. Examine your strengths, weakness, and interests. And so as I talked about earlier, I knew I wanted to be in health in some type of way, but I didn't know exactly what I wanted to do. And so my interest and my career wasn't really aligning. if I could go back and do it now, I would probably have chosen a career in or a degree in kinesiology. That way it would lead me into the fitness part of it. But I didn't know. And so you are now in a position where you can examine and really evaluate what are your strengths, your weaknesses, what do you really like to do, and then ask yourself, do my strengths align with my current path? Do my interests align with my current path? And so am I doing this for myself, or am I doing it because that's what my family wants me to do? Am I doing it because that's what I've been told makes a lot of money? And I will say, a lot of times in public health, for me, a lot of careers didn't pay much. But as I was moving through my career, it wasn't really about the salary. Yeah, I wanted a nice salary to be able to live to the standard that I wanted to live, but I also understood that it takes time to get there. And as long as I'm doing what I love to do, what I'm called to do, then I would get there at some point. And then prioritize. Define what's important to you. Is it important to you to be able to help people? Or is it important to you to be able to help people from behind the desk? So just look at yourself and think about what's really important, what will help you get where you want to be, and then plan. And I say make an amendable plan, because we know that life isn't just this straight and narrow path. Life takes us down so many different winding roads, and we can make all types of plans, but sometimes we have to go back and reevaluate and say, okay, I may have messed up a little bit there, but I'm still on this same road. It may be winding and it may have so many roots and bumps, but I'm still on the same path. And so you really have to be open to that. And, try not to put so many restrictions on your life. I have to do this by this date, and I have to do that by that date. Make sure your plan is flexible enough that, if something doesn't happen by December 31st, 2016, it's not going to be the end of the world. And then take risks. I always tell people, if you're young and if you don't have anything holding you back, try. Just nothing beats a try. Whether it's doing a mission trip in a foreign country, whether it's studying something in an underserved community, whatever it is, just take that risk and take advantage of experience and opportunities. If there are internships in the field that you want to be in, start speaking to the people who are over those internships. Align yourself with the right people to help you get where you want to be. And that's one thing that I'll say that I left off, is develop relationships and find you a mentor. Align with all these people that can help push you along, and get around people who are doing what you want to do. Find someone who is in a career that you want to be in, and just develop a relationship with them, because that can really help you decide, I really don't like this, and so maybe I should choose another path, or this is exactly what I want to do. So the action part of it is the big thing. So putting it all together, I truly believe that each person was uniquely designed to fulfill a purpose on earth. And so, as you heard in my bio, my purpose is to be a servant. And I just happen to serve people through helping them get healthier, whether it's through personal training, whether it's through just a conversation. I try to live my life as a servant, and so that's what I'm here for. Everyone is different, and so you have to just figure out what it is that you're placed on this earth for. But discovering that purpose takes us through many winding roads, as I talked about. I've always been on this path of health, but then I'll get upset when people don't do what I think they should do, and then I have to double back. But at the end of the day, I'm still fulfilling that purpose. So then as a college student, be selective about the activities that you participate in. When I was going through my doctoral program, I did go through the PPE training, and it was an awesome training and an awesome opportunity to let me get out and talk about health and get some experience in health education. And one of the things that I'm really fortunate for is through my doctoral career, I was able to work in the field. And so that really helped me through academics as well as like just really gaining experience on what I wanted to do. And then be purposeful and experimental in your collegiate career to really help you better define your next steps. And so be deliberate about everything you do. I'll be the first person to say I really enjoyed college. I had a good time during my undergraduate career. I always say college does not owe me anything, but be purposeful. Have a good time, but you're there for a reason, and that's to get out and contribute something to the world. And so just make sure that whatever you do helps you define your next step. And then find a mentor. And I said this before, but find a mentor, someone who is doing what you want to do and on that path, and they will help you along. And so the little quote that I have at the top is, love what you do and you'll never work a day in your life. It's cliche. You've probably heard it time and time again. When I was in undergrad, I had to do an interview with someone that was working in a career. And I interviewed my aunt, who is now deceased. And the ending quote that has always stuck with me from that interview was, do what you love and you'll never work a day in your life. And after she passed away my sophomore year of college, and that always stuck with me. And I like to think that it was just one more notch in this journey to where I am now that has kind of helped me get to where I wanted to be. And then passion. Passion is the difference between having a job or having a career. And I always tell people, sometimes you do. You have to work a job to get where you want to be. But having a career is totally different than working a job. Having a career is much easier to wake up in the morning and go there if you know that you're going for a purpose. So that is all I have right now, and I thank you for your time, and I guess we will open it back up for questions at this point.
Yep, thank you so much, Dr. Burse. That was a great presentation. Like she said, the Q&A portion has begun. We have a few questions already, but go ahead and use the questions box if you would like to get if you would like Dr. Burse to answer your question. So we have a question based on one of your earlier slides. You had mentioned community scholarships. I believe you and your sister had started. How did that come about? And you know, how could maybe a PPE or somebody host their own community scholarship?
So I get that question a lot, and maybe, let's see, it's been about 6 or 7 years ago. My sister and I decided to start a scholarship, and we are from, I've always said it's a small community, and that community is the high school that I went to was about 10% African American. And when I went off to college, I did have enough scholarships to cover only maybe my first year of college, and I just had to find everything myself. I had to figure out how to get money without getting loans myself. And then my sister came to college about 3 years after I got to college, and so I was helping her figure out how to get money. And so we started thinking, okay, we don't want everyone to have to struggle like we had to struggle to find money. And so we said, let's do a scholarship. And so the first thing we did was went to the Secretary of State's office and incorporated it as a nonprofit. And so when you incorporate as a nonprofit, if you don't plan to raise a certain amount of money, then you don't have to get the 501c3. And so with that, we only wanted to give a scholarship, so we didn't really have a big need for the 501c3 because we weren't trying to raise more than like $25,000, and I think that's what it was. And so the first scholarship we gave was a book scholarship for $600 to a student. And so then after that, we started having a banquet to raise money for the scholarship because we wanted to give more. So we gave out a $1,000 scholarship the next year. So we had a banquet, and we would bring in speakers. And so then when she and I both kind of moved away and started going into different areas within our careers, the banquet got to be a little too much for both of us to handle. And so now we still give out the scholarship, a $1,000 scholarship every year. And we don't so much solicit donations. We just kind of give it on our own now. And the banquet idea was really good, but it does take a lot of work. And so the first thing you do is decide how you want to raise money. And people that I've talked to about this, what they've done is they've gotten maybe their class together and had everyone in their class donate maybe $10, and they give a scholarship like that. We do have an application process, and our criteria is they have to be African American, they have to have at least a 2.5 GPA, and they have to write a couple of essays. And I will say that we have not had many applicants because a lot of kids just don't want to write essays. But one thing that I heard previously is I asked a young lady, please apply for the scholarship, please apply. And she said she didn't want to write the essay. So she came back to me the next year and said, I wish I had written that essay. And our thing behind that is write the essay. It'll help you gain skills for other scholarship applications. And so we're trying to build skills and also create responsibility in these students. So I hope that answers the question, but it's not a very hard process. Go to your Secretary of State's office and you can get the incorporation papers back within maybe a day or two, and you do have to have articles of incorporation, but on the Secretary of State website, they tell you exactly what you want in that, and you just have to put your organization's name in it. So it's really, really simple. The hardest thing is raising the money.
Okay, thank you very much. So this next question, I'm going to combine two questions because I feel that the answers may be similar. So the first question is, where does someone in the studying public health, where do they go to seek guidance or mentorship, or where did you go to seek guidance or mentorship? Do you have any examples? And the second question, you mentioned your father a lot. What role does he play in guiding your professional career?
Okay, so for mentorship for me, I kind of just try to align myself. Like I said, I'm an extrovert, so I just talk all the time to a lot of people. And so one thing that I actually did was one of my dissertation chair, she and I developed a really, really good relationship. And so if I have an idea, I always run it by her. And she is very, very blunt, and she'll say that makes absolutely no sense. Or, yeah, that's really good, but just change it here or there. And so for me, I found that within someone in the academic arena whom I was very close to, but also in my previous position, the other director that worked with me, she started out as my supervisor. And I saw how she managed. I saw how she spoke with her staff. I just saw how she was just like this no-nonsense type of person. And I liked how she managed. I liked how she organized. And so I started just hanging out with her and like really aligning myself with her. And she and I ended up working parallel to each other. So she pretty much helped me get to that director position, and but she and I, we still talk a lot. We have a very good relationship, and if I'm going to make a decision that's big and send it, even sometimes if it's an email that, I just kind of want her to help me flesh out, I'll call her. So that has been, those two people just kind of stood out to me as I was kind of matriculating through my career. And I did talk about my dad. My parents both, they're divorced, and they both played a major role. When I decided that I wasn't going to medical school, it was hard for me to tell my mom because, you know, she was in the medical field. And then when I told my dad, I can remember sitting at his table in his house, and he said, just make sure you're doing what you like to do. And so that really helped me. And it actually brought my mom around because I started telling her, I can make a living in public health. I can make a living doing this. I'm not going to be like standing on the street corner giving these messages about health and not getting paid for it. And so it took a little bit longer for her to come around, but my parents have both, I'm very, very fortunate to have the support system that I have. If I'm having any type of event or doing anything, they are both going to be there no matter what, with bells and whistles. And so I do think that has played a part. And my dad, he has always, I call him a serial entrepreneur because he's always just have these ideas that he wants to do, and he'll just do it, you know. And he may not last for 2 or 3 years, and it may, but he takes those risks. And I think that's one of the traits that I get from him. It doesn't, to me, I'll take the risk because I'll regret it more if I didn't try.
Okay, great, thanks. Next question. On your journey to creating your ideal career, did you have to navigate envious individuals who were not self-starters such as yourself? If so, how did you deal with the haters?
Okay, let's see. I will say that when I was matriculating through the process at my previous job, going from a specialist to a director, there were people that would say, have little things to say that you hear about later. And so my thing was always, well, if I do my job and I do what's right, then they can say whatever they want to say. And so typically, when that happens, things come full circle, and people will begin to see that you're not this villain that they've made you out to be. And so I really keep the people that really, really care about me close. And so I try not to have room for so-called haters, I guess. And so, I don't even let that type of drama, even come my way. I guess I'll say that, because I always think there's too much work to be done for me to be trying to please everybody or trying to deal with people who don't really care. And so I just let my work speak for myself.
Okay, next question. Can you give some best practices or examples on on establishing a rapport with unfamiliar or new communities, or communities you're new to?
Yes. Find a gatekeeper. Find a gatekeeper, because whether the gatekeeper is friendly or not, they will allow you access to that community. And if you find that gatekeeper, it takes a lot of working. And sometimes you may think that the person that's standing on a podium speaking for the whole community is a gatekeeper, but they're not. That it may be the little woman at the church that attends the Silver Sneakers class every Wednesday at noon, that knows that's the gatekeeper for the community. So it takes a lot of exploration. I'll say that one program that I'm working for right now in the Mississippi Delta, we are trying to increase access to different forms of birth control. And so champions and things have been given to us. But then when we start doing exploring, we get these little nuggets of information from different people. And so then when I started getting those nuggets of information, I just started latching on to those people. I mean, you can be nosy. Just an easy way to say it. You know, my husband calls me nosy, and so I'll take that. In this instance, it's a lot about observing, and I think my career or my academic career in public health has really taught me to observe. Like, I usually don't miss anything, and I take mental notes of everything, and physical notes a lot of the time of everything. And so I always revisit those things when I'm going into a new community. And, you know, a lot of times, like in the South, the church is where you start. And so you just have to figure out what is the big thing in that community and just start drilling down to each person.
Dr. Burse, can you tell everybody how they can reach you?
Yes, I'm pulling my slide up now. There you go. There's my website, my email address, and my phone number.
Great. So we have a couple more minutes. So if we can just quickly get through a couple of questions. I'll just throw the last two at you. Can you also talk about entering faith-based communities with public health messages, specifically reproductive health? What are some of the issues you run into, and how do you deal with those? And lastly, you mentioned that you do everything on your own, administrative work with your business. Do you offer any internships, or are there opportunities to volunteer?
So the first question about the faith-based community, Mississippi is, or the South really, is just the pillar of the faith-based community. And so a lot of work that has been done here has been to get pastors and ministers on board, because most of the time the congregation is going to listen to what the pastor says. And what it takes for most of the faith-based communities that I've seen is just to care and to understand where they're coming from. Because though you may not agree with, you may not believe in what they believe in, their belief is founded on something. And so in this field, you have to realize that sometimes you have to check your beliefs at the door. I consider myself to be a Christian, and a lot of the work I've done, I've had to just leave it at the door, because I can't judge a group or a person on what I think they should or should not be doing. And so I think you have to take that same mindset into the church. And there have been several presentations and organizations that I've seen do a really good job of this by using biblical principles to show the church how they can bring this message into the church. A lot of what I've seen done and what I've worked with is doing like reproductive health and HIV and AIDS and STD work within the church. And surprisingly, a lot of ministers do want this in their churches. And I've seen ministers that will get up, that will lead the charge in taking a test. And so it hasn't been so hard to do that here, because people want it, but it's just the perceived fear. And so it's just about taking that one step, and the minister is you, or the pastor is usually that person that will let you come in and really put the message out. And when they say, I'm doing it and we should all be doing it, then everybody usually jumps on board. And so there, here in the city, there are several organizations of, kind of coalitions of pastors that have come together to really move this work forward. But I think a lot of it here is just the perceived fear. And also what I've done is I've served on the governor's task force to prevent teen pregnancy, and this is a very, very, very conservative state, and some of the sex education laws that we have are much different than they are across the United States. And so being able to sit in on those conversations to see what's being said and being able to take that back and use it as leverage, not as a hindrance, but as leverage to get in those communities really helps. And so for the last question about internships, I really hope that I can offer those things in the near future, probably not until the beginning of the year once I kind of hash some different things out. But if anyone is interested, you see my email address and my phone number there, please let me know, because I really hope to be able to offer internships in the very near future. And I will say, I guess kind of as an ending note, I have been very, very blessed to be in this position. It has been very easy, but when I look back, it's only been a year, not even a year yet. And so that's how I know that I'm moving forward in what I should do. So even on the days when it gets really hard, I've had all kinds of family things that have come up over this time. I mean, just back-to-back deaths and all kinds of things that happened. But I had to keep moving because, like I said, I didn't have any other staff. There have been times where I'm on a conference call and I'm sitting in the hospital waiting room. There have been times when I'm completely doing work in the hospital waiting room. And I've had family members say, "Is that all you do all day long?" But, you know, I'm on a mission, and we're on a mission to create these healthier communities. And so it has just required a lot of hard work and a lot of thick skin. And so everything that I've done from high school to now has really culminated to this opportunity. And, you know, we'll take the good with the bad, and send me your resumes and your information, and hopefully we'll be able to connect.
All right, great. Thank you so much, Dr. Burse, for the presentation. We really appreciate it. For those who don't know, Dr. Burse is based out of Jackson, Mississippi. Is that correct?
That's correct.
Okay, so if you're in the area, some of our newer PPE sites, please feel free to reach out to her. There's also a training in Mississippi at Tougaloo. This training is September 30th. You can reach out to me via email or to Jasmine Taylor. I can give you her information if you would like to attend. This concludes our webinar. Again, we'd like to thank Dr. Burse for her time, and thank you all for joining us. And this will conclude the webinar. Thank you.
And I will be at that September 30th training.
Oh, okay.
Yeah,
great.
I'm presenting. So I'll be there. If anyone is in the area, I'll be there.
All right, great. Sounds good. Thank you once again.
Thank you.